Seed cycling is not going to help you. If a guy's testosterone dropped, he's not going to be eating pumpkin seeds and sunflower seeds. We need actual solutions. Those things, yes, they can help, but they're not solutions, right? So collagen, right? Collagen makes our skin look youthful, plump, elastic, firm, hydrated. Estrogen only remains elevated for about 10 days out of a 28-day cycle, right? So for about 2.5 weeks, it's relatively low, meaning that your collagen is also relatively low. These are the times when you look in the mirror and you question whether you actually slept last night, and likely that you didn't, because estrogen also regulates melatonin. You might notice more fine lines, dark under eyes, breakouts. You look older, don't you? Collagen also affects bone density and wound healing. And vulva function. Your vulva, your vaginal canal, doesn't have the same stretch capacity to receive after you ovulate. So sex during this time is uncomfortable, right? And you know this. So lower estrogen levels, such as those that you experience in the second half of your menstrual cycle, impact not only skin health, but bone health, your body's ability to repair tissue, and sexual health.